knowledge, skills, and resources, but I am aware that the surgery was an abject failure. It was not properly done. It not only did not correct the problem, but also added to her misery. The doctor who performed it lacked compassion and decency. The system had failed Sally. Doctors were frequently on strike for no legitimate reason. Medications were not given to patients at the appointed time because of the strike. Surgical wounds were inadequately cared for because no one was paying attention and let them become infected. And doctors weren't paying enough attention to ensure their surgeries were successful. So with all this being said, what do you think some of the steps that need to be taken are to start improving the system?
Well, I know that compassionate care is an important part of medicine. First, you have to acknowledge that these are human beings before you, whether they are poor or rich. You have to know that they belong to families, they are individuals. So when you're caring for patients, you want to, for instance, describe for them what is wrong. As much as I thought I was knowledgeable, you couldn't get any of them to really tell you what is wrong. It's as though the patients should not know. If you didn't have something as blatant as breast cancer, where you yourself can see that your breast is really having a problem, you would not know what's wrong with you. So doctors need to communicate what the patients are suffering, what they need to do. And we know also that because of lack of funds, many people have to go back home to die. And that brings us into something else. The informal group system is also extremely impactful. We have people who, there's a story in the book about a young man who fell from a tree trying to cut palm nut for the neighbor as a job to help take care of his widowed mother, and fell and broke his spinal cord. Under normal circumstances, he really would have died because the system was not set up to take care of him. And the family did not have money to do that either. But when he returned back to the informal system, the traditional birth attendants, the traditional practitioners, they were able to put together those broken bones. And a child that was supposed not to walk again actually walked. And so there's a system there that needs to be improved. They did that with the traditional birth attendants, so that reduced infant mortality rate associated with tetanus, for instance. But so bone setters are very powerful ones. My mother, when I was young, I fell from the tree from jumping high jump at school. She was the one who haven't learned to do bones, piece together those bones. And here I am today, I'm walking. So that system exists, and the government just needs to know how to bring them in without too much English, without diluting what they know, but incorporating them in the system. But we need to make sure that you can advocate for your family. Because one of the things that is missing is your inability to advocate. Whether the care is available or not, you need someone who can speak up, ask questions. You have 4 doctors for 10,000 people. So even here, where you have 15 minutes to wait, there you really don't have that 15 minutes. And if you don't know how to navigate that system, you won't really get the care. You know, so you have a culture where people just go to the doctor and come back and says, oh, I'm so sick, they gave me injections. They're happy to get injections. But the rest of it is difficult to say what actual care they receive.
Yes, and I actually want to highlight that you mentioned in the book that oftentimes they won't even discharge you unless you pay for it, and so that leaves patients sometimes sleeping on the floor waiting for relatives to come in and pay. But you actually, in many cases, paid for other people's hospital care. Do you have any stories of maybe one of the patients that you were able to help support?
Oh, thank you so much. And that speaks to our willingness to spread ourselves. When we are here, we're comfortable. Food is not an issue, and basic life amenities is just not a problem for us. So when we go back there, you encounter so many things. So that $2 of not eating McDonald's that you save, one of my first thing when I do go back is to go to the clinics and see which patients have been discharged and are still on the floor awaiting families to come. Sometimes they will sell their farms or sell their family lands just to get out of the hospital, because you stay there, you get sicker. You're sleeping on the floor. What else? Because they need the patient's bed, but you can't leave. And so my job is to go when I do go, and well, I have a husband who's, he would always ask me, how many did you see today? So even if I've forgotten, I will be forced to go and find them and then pay to have them released. So we must encourage. Many of our teachers, for instance, over there don't have salaries, so 6 months they haven't been paid. So when you're here, find a primary school, find a college, just make a small donations to the teachers fund and see if you can help them.
And I also wanted to share this one statistic that you put in the book that I think highlights the lack of doctors within the medical system that we need. It says that the World Health Organization reports that Nigeria's physician-to-patient ratio is 4 doctors per 10,000 patients. Just wanted to say that one more time. 4 doctors for every 10,000 patients. And the data from World Atlas shows that other countries like Qatar and Cuba at least have 77 doctors per 10,000 or 62 doctors per 10,000. Why do you think that there's not as many medical professionals back home, being able to do their work?
Well, Africa is a rich place intellectually and otherwise, and Nigeria is no exception. And if you know, when we come here, for instance, the average Nigerian parents wants their child to be a doctor. And so being a doctor is not a difficult part, but it's that the resources to pay them, they are underpaid, they are underutilized. The specialization that they need is not there. And so other countries beckon. And so there's a brain drain. They just leave to go elsewhere. So even after you've trained them, they are not in the country to assist. And then you also have where government officials are eating up budgets that's meant for the medical profession. And that was one of the reasons when we were there, we were told they were on strike, that they would not release money because it's getting more interest in the banks than being used to pay staff.
Mm-hmm. Wow. What do you think other families struggling with the system, now that you have the wisdom of having gone through this experience, can do differently? So in other words, how can they learn from your experience?
I think we have an opportunity. I think we have an opportunity coming from here to impact how the system is set up over there. First of all, I know that nurses are not utilized to their capacity. Many a times the nurses were not allowed to put IVs. And so we're asking the government, if you're training nurses, you won't want to train them at the level where they can do the basic medical care, even when doctors are not available. Nurse practitioners, for instance, must be an integral part of the system, because here, even in the United States, in places where there are no doctors, nurse practitioners have actually taken total control. So you will be there sick, and the nurse would tell you, sorry, I can't touch that. Sorry, I can't do that. I can't even resuscitate. So the government needs to impact nursing education. If they are not trained adequately, then they need to do that. But also the responsibility to have physicians not go on strike and being paid for it, and also being responsible for doing what they're supposed to do. You can't have an orthopedics a podiatrist doing the work of an internist when they're not trained to do that. And so if you're going to specialize, if you're going into specialization, then there's a need to ensure that the training exists. I think, for instance, you can't take many of those we encounter had to take themselves out of the country, study for 6 months, and run back. You cannot get enough of those happening. So I think the government needs to be able to bring back, maybe invite expatriates to come and train within the country, so that instead of one person going out to receive a specialized education where they come back and they're the only one for 10,000 people, you can bring them to be trained there and have 300 doctors being trained at the same time. So we think the government has a responsibility to ensure that physicians are paid, to ensure that they are adequately trained, and to ensure that they also have living wage. Without that, they're going to leave.
Yes, and I hope so. I hope we get to see these changes in our lifetime. I guess since the events of the book, have you seen any improvements that make you hopeful for the future?
Yes, I recently was involved with a woman who had breast cancer. She went into the doctors to the hospital, and she was told to go back and bring 1.8 million naira so before she could be seen. Well, the time between when she was to raise 1.8 million naira, if you see the picture of that breast, you yourself, you will cry. Well, when I was drawn to that situation, the first thing I asked was, who is a doctor? And I made phone calls to the hospitals. I got the doctor to contact the woman, brought her back to the hospital, assessed her and said, if there's anything you can do, then we're going to mobilize here. So many people mobilized here to get that woman the care she needs. It's like night and day what happened. And the hospital knew that they had people behind her. And so they were able to treat her with the utmost respect and care. And the doctor himself will be sending, surgeons are sending pictures and showing infections and how they've treated infections. So I think that system, she was privy to enter a system that actually had the resources. It's just that she did not have the resource.
And thank God for that story. That really does give us a lot of hope.
Yes.
I hope to see more situations like that in the future. And I'm sure you've had to deal with a lot of emotional impact because of this book. How do you handle the responsibility of being a catalyst for change?
Well, sometimes we must always understand that the way we see ourselves now is not how we will be seen tomorrow. That means that you may not have a voice now. My little Sally, who died, did not have a voice. But from her incident, from her demise, we now have a very quiet, vulnerable voice that is speaking to generations to come. I think the young people would be mobilizing to demand more of their healthcare system, to demand more of their government. I think when we hear stories, one of the things that was instrumental in me truly getting through, besides just relying on the Lord for insight and memory, is that I reached out to my siblings. There are so many wonderful stories about sibling love in this book. And I think we must remember what it feels to be a family. We can't let that go. That family love is extremely important. It's important when the government fails you. It's important when the system is not there to hold you up. If you don't have that, for instance, you enter a system of care, and we are hoping that the medical system, the government will have a system where blood is really available. You don't have to wait until you can rally villagers to come and donate blood before your person could be seen, and which is valuable time would have been wasted. So just relying on family love and having a walk, a personal walk with God during this process.
So we're about to start the Q&A session, but I wanted to ask you one more question, and everyone feel free to start lining up. There should be a microphone in the center over there. So please, if you have any questions, please come up and ask away. But to summarize, what do you hope that people take away from the book as they read it?
I think perhaps to understand that life is valuable and to also understand that we're each other's keepers and that it's important not to forget where you come from. It is important to, there's a Ghanaian bird, I believe, called the sankofa. It kind of reaches its back to come forward. We must always reach back. We are each other's keeper. You survive. Your survival is important because there are many others that are waiting on you to survive for them to survive. And so to not think that your $2 here can make a difference. In the story, for instance, one young woman here bought a medical encyclopedia for one of the village doctors because he was using a book from 1960s. And so that in itself, I mean, if your family was going there, you have villages where every young man has appendicitis. They have wounds. So if you come from that place, then it's incumbent upon you to make a difference. Your knowledge, your access to risk, don't waste things here. That Gucci bag is not necessary. That Louis Vuitton is not necessary. There's so many crying. And the funny thing is, as they cry and as you lift up a hand, in your time of need, the spirit controls the physical. You don't know how God will mobilize others to reach out and help you. So we're each other's keeper. You must understand that you're not here for yourself. Your life is not valuable based on what you're wearing or how much you're eating. It's important that you be remembered. Be remembered by your society. So when you visit, it doesn't matter here, even in this culture, that people were suffering. We don't say this is a perfect system, but we just know that the resources are available here, and if you know how to mobilize it, you can mobilize. So if you have clinics that have no medication, do help out because patients are in terrible pain. So I want you to know that your hearts are wounded when you can't reach out and help another. You're walking around wounded.
Amen. And I pray that Sally's legacy and memory continues to live on through this book and through the advocacy that you're doing. I wanted to turn it over to the audience now. I'd especially love to hear from anyone who has family back home that maybe is going through something like this. So please, if you have any questions, please volunteer to answer. Okay.
Hi, congratulations on your book. I
Thanks.
haven't read it yet, but it seems like we are on the same page with a lot of things. I've already expressed to my family members about going back home to help the best way I can. My cousin died, my aunt died. And I just wanted to know, do you think something like universal health insurance, something like a universal health insurance implemented in Nigeria would be effective in that first step to healthcare, to accessible healthcare for those that aren't so fortunate to get there? But when I say my cousin died and my aunt died, it was for two reasons. It was because they couldn't get to the hospital on time. And for me, that's always been, that happened when I was a kid. I was in Nigeria at the time. I was just born, I was maybe like 6 or 7. And it just didn't make any sense to me how the only reason they could not survive because they couldn't get there. Can you hear me now? The only reason they could not survive is because they couldn't get there with the adequate amount of help. And growing up throughout, I'm not necessarily like knowledgeable on what's going on in Nigeria. I just know that that is something that touched me personally. And I've always talked about it, but I wanted to know, what do you think would be a good solution? I've always thought about healthcare and health insurance, but another idea that I had was urgent care centers, because we have so many of them here where you don't necessarily need to go directly to the hospital to get the help that you need. You can just stop at an urgent care center and get that quick care, you know? And I just wanted to know what you thought of, like, or what ideas you think we could implement in the system in Nigeria to help us get to not even fully where we are here in the US or in westernized countries, but just a quarter of the way, just a step forward?
I'm not an expert on that system, but I know that my experiences in terms of going back and helping, providing free clinical services, free doctors, medication, nurses, health educators, social workers. I know that some of the, for instance, the local clinic, and this incident written about in the book, it's in a major facility in town. So, but my journey started, I chronicled it from that village health system. One of the things they will tell you in the local system is that people would take the drugs, they would take the medications if you put them there. Why? Because you have peddlers. Peddlers who are trying to survive, families who are trying to survive, and they will come and maybe pay the clinic person and take some of those drugs, go back to their homes, mix it with whatever to increase the number that they can sell. And that's noted even in this book from one that was closed. And so the system itself, people need to be honest, and they also need to value the lives of others to begin with. And then the resources are not there. And so you have the basic health care, the basic things. Even when you've prescribed medication, for instance, when I went back, so many people had stroke, and they all had high blood pressure, but they can't afford the medication. So what's the best thing to do? Perhaps health education might be instituted or become a big part of the healthcare system. So there are things like diabetes, which is floating rampantly there. And it used to be malaria and typhoid. And when you go, anything you're sick of, they say it's malaria and typhoid. So whatever labs they're taking you, they're only able to pick up malaria and typhoid. So how do you cure something you can't see? Because the supplies are not there, the equipment are not there. So it's a long way, but I believe that if the government values the life of its people, because that's the power of the society, then they would indeed make health provisions, the healthcare system a priority in terms of national health insurance. There's some capacity that is done. To some abilities, that's being done. Because I think you have the free clinic for maternal health. So you have some variations, a little variant of it.
16, 17, about to graduate high school, focusing. I had told him, no, like I wanted to create some kind of ambulance system just to get us to the hospital. And I told him the plan, and I told him my intentions, and I told him why. Family reasons, of course. Personal. More the same. How, first of all, you're American. You're already obviously American. So when you go back home, you're already a target. That's one. Two, so you build this ambulance system. You now have to worry about the safety of your employees, the safety of the patients, and then on top of that, the drugs that are in the ambulance or the equipment that you need to help these people to keep them alive. You have to worry about it getting stolen. There was just so much that he added to it, and
Well, I know that there are teams of medical professionals here who live here, the United States every year for different parts of Africa. I've encountered some of them. Dr. Vaughn, an AIDS specialist, usually would also go, and you have eye doctors and other nurse practitioners, very robust medical teams. They would go stay for a month in a community and then move to another one and would be there for 3 to 4 months and then leave. Yes, those are ad hoc, but I think if you begin a process like that, if you listen to what people tell you you can't do, then you'll never achieve anything. You rather fail on your own terms that you don't even begin. That may be your calling, and perhaps by you starting it, you raise the consciousness of others. Because when I do go and begin that process, you have doctors who would say, okay, I'll donate this, I'll donate my time, don't pay me for this hour. So you have them also raising the awareness of their own immortality and the need to give back. Yes, you will have those systems, but when you begin to have those systems, you also become an employer. And so you have a way of stabilizing things that would have been stolen if you just did not put it in a proper format. So I would not allow anyone to discourage me, and so I don't think you should as well. I think all you need is to plan well and get some very informed people around to help. And if you're targeting a community, make it valuable for them. Perhaps you don't give them free care, but you ask them to pay 1 naira. That's more valuable. And so they're better able to take care of their resources if they know they're paying something for it. It's just strategy. Thank you.
Yeah, I wanted to add to that as well that there's a lot of power that actually comes with being an American Nigerian here. I remember in the story how when you went back and how the doctors treated you differently and would provide more information. You mentioned that they don't usually tell patients' families what's going on with the patient. They hide that information, but they were more open to telling you because they knew that it won't go over your head.
But even when that was done, at the end, when we were told that Sally had a year and a half to live, and the doctors, when I confronted them, said, well, your colleague says she has a year and a half to live. I thought it was just a simple surgery. What did you do? So they had taken parts of her that they were not supposed to take out. But they were upset that that information had been given to me. And so they're not really allowed to share. You wouldn't know what happened to your patient in surgery or any other care level. And so but just being able to navigate the system, negotiate the system, that experience taught me that this time around, that woman who would have just died a careless death survived. So you have to be able to marshal all your resources. Advocacy is extremely important, and holding them accountable is important.
All right. So with that, we're about to move into the Thanksgiving portion. One more question, please.
Really a question. I just want to a little more of what she one way, even if not establish something. At least America and some other countries around have system in place where they have regulatory bodies that regulates what you do, license you get. They have do certain things, you are held accountable. But in our country, there are certain things that people just do without nobody guiding them, nobody, no regulation, nothing. They just do whatever they want to do. If you fix the system, then definitely when tool is operational, definitely the things that from the